Easy to follow guide to an acne-free skin. Great tips for all those suffering from acne. How can you avoid acne infections with simple skin care techniques? Do you know that just by following some simple skin care techniques you can avoid the problem of acne? Here are those techniques. Follow these suggestions and stay away from acne. Regularly wash your face. Wash your face with a mild cleanser 3 times a day. Also wash your face after heavy exercise. Generally, some people with acne try to stop outbreaks and oil production by scrubbing their skin using strong detergent soaps and rough scrub pads. Though scrubbing will not improve acne, it can make the problem worse. Importantly, don't forget to rinse your skin after washing. Shaving and acne. Those who have acne can use electric or safety razor, which is more comfortable for them. Guys who use a safety razor should use a sharp blade. They should soften their beard thoroughly with soap and water before applying shaving cream. Nicking blemishes can be avoided by shaving lightly and only when necessary. Don't handle your skin frequently. People who squeeze, pick or pop their zits develop scars or dark blotches on their face. They should also avoid rubbing and touching their skin lesions. Avoid sunburn and suntan. Many of the medications used to treat acne can make a person more likely to sunburn. Sunburn that reddens the skin or suntan that darkens the skin may make blemishes less visible and make the skin feel drier. But these benefits are only temporary. And, there are known risks of excessive sun exposure such as more rapid skin aging. There is risk of developing skin cancer too. Tips for choosing makeup. If you are getting treatment for acne, you need to change some of the cosmetics you use. Cosmetics you use should be oil-free. It will be hard to apply foundation evenly during the first few weeks of treatment. It is because the skin becomes red or scaly with the use of topical tretinoin or benzoyl peroxide. Oily hair products may eventually spread over the forehead and cause closed comedones. So it is advisable to use products that are labeled as non-comedogenic. And, in some people, even these products may cause acne. So it is necessary to take extra care with makeup. Skin care for acne. Caring for your skin is important for good health and beauty, but especially so if you are prone to acne. One of the best ways to keep acne under control is to maintain your skin's health as much as possible. This means keeping the skin clean and protecting it from damage from sunshine and harsh cosmetics. Cleansing your skin. Wash your face twice a day with a gentle soap or special acne skin cleanser, using a gentle, circular motion of the fingertips. Do not scrub, since this can aggravate acne. Moisten the face with warm water, then apply cleanser from the hairline to the neck. Rinse with lots of water and pat dry with a soft towel. Those with especially oily skin may need to use an astringent, but it must be alcohol-free, and used with care. Apply it only to the oiliest parts of the face and discontinue use immediately if your skin becomes irritated. If you feel you need an astringent, you may need to see a dermatologist instead. Hair care is also important. Shampoo twice a week to as often as daily, keeping the shampoo away from your face as much as possible. Protect your skin from the sun. A suntan may dry your skin, making the acne less noticeable, but this is only temporary. As your skin becomes accustomed to sun exposure, the acne will flare up again. Meanwhile, you are risking skin damage that can cause premature aging and skin cancer. Many medications that treat acne cause the skin to become more sensitive to sunlight and more vulnerable to burning. Whatever the weather, you should wear sunscreen on your face and any other exposed skin when outdoors. Choose makeup with care. The best choice for good acne skin care is to wear no makeup at all. But if you feel you must wear makeup, choose products labeled non-comedogenic, that means they will not clog your pores. Be aware that these products may still cause acne in some people. Above all, avoid makeup with an oil base. Read the labels carefully and use sparingly. Shaving. Try both electric razors and safety razors to see which causes the least irritation to skin blemishes. Always use a sharp blade in a safety razor, change the blade every 2 or 3 shaves. You may have to shave around blemishes to avoid cutting them. Be sure to soften the beard as much as possible with warm water and shaving cream before starting. If your skin is covered with blemishes, perhaps it is best to skip shaving that day. No touching. As tempting as it may be to squeeze pimples, don't. That invites more trouble by spreading the bacteria which cause pimples. It can also lead to permanent scarring. Try to avoid touching your face as much as possible because the hands carry dirt, oil and germs. Rest assured that acne can be brought under control. Medications will go a long way toward clearing your skin of acne. Your job is to help the healing process along as much as possible by taking good care of your skin. Skin care for acne sufferers. For many cases of acne, a physician will recommend that individuals gently wash their skin with mild soap and possibly a cleanser. The best time for acne sufferers, or anyone, to wash their skin is in the morning and the evening and following any exercise program. In caring for skin, many acne sufferers believe it's better to scrub their skin in hopes of getting it clean. However, this is not a good idea. If you already suffer from acne, scrubbing will only make the condition worse and may cause irritation to your otherwise healthy skin. Instead, gently washing the skin with a soap that does not contain harsh ingredients and contains some type of moisturizing lotion may help to cleanse and rejuvenate without the potential for irritation. Individuals who notice the presence of acne should avoid the temptation to pick, squeeze or pinch their blemishes. This action may lead to scarring or even infection if not left alone to heal. In addition, acne breakouts should not be touched or rubbed in order to avoid irritation. Individuals should also avoid a sunburn or suntan for the sole purpose of concealing acne. Because either of these two darkens the skin, many believe that this will lessen the visibility of their breakout. While this may be true, it is also very temporary, and it's important to note that prolonged exposure to the sun or tanning bed may increase the risk of early aging signs, developing skin disorders or even cancer later on in life. If they are makeup wearers, individuals who are being treated for acne may wish to reconsider their choice in cosmetics. Any type of product that is used, including foundation, moisturizers, eyeshadow and bush, should be oil-free. It can sometimes be difficult to evenly apply cosmetics when acne is present. The reason is because it's nearly impossible to get a smooth application when your skin has red bumps or inflammations. The best way to conceal blemishes is to dampen a makeup sponge before dipping it into the foundation. Once the foundation is present on the dampened sponge, it should be evenly applied over the face. This technique will provide better coverage for acne sufferers and will result in a much smoother look than just using a dry application. When some people think of skin care, they feel that they couldn't possibly have the time to devote to making their skin look and feel great. The truth is, however, that regular cleansing with the proper soap and choosing the right cosmetics can go a long way in improving the tone of your skin. In addition, skin care is linked to other factors, including diet and exercise. If you can maintain a well-balanced diet and participate in an exercise as simple as walking for 30 minutes a day, 3 days a week, your skin tone will improve dramatically. The information in this article is intended for informational purposes only. It should not be considered as, or used in place of, medical advice or professional recommendations for the cause, diagnosis or treatment of acne. If necessary, individuals should consult a medical doctor or dermatologist for information regarding the use of cleansers or other effective treatment methods. Skin care for adult women with acne. Acne affects some 25% of men and 50% of women at some point in their adult lives. The treatment of acne can be difficult for some women who also want to pay attention to moisturizing their skin. Acne in women can be brought on by many different factors. Some are easy to figure out. The use of heavy cosmetics can bring on acne. This is simply remedied now. There are many new cosmetics on the market today which are non-comedogenic, meaning they won't clog pores. Also found it. Acne affects some 25% of men and 50% of women at some point in their adult lives. The treatment of acne can be difficult for some women who also want to pay attention to moisturizing their skin. Acne in women can be brought on by many different factors. Some are easy to figure out. The use of heavy cosmetics can bring on acne. Also, foundations are much lighter than they used to be. Some powder foundations are now made with minerals, which are much lighter than heavy liquid foundations. The use of some hair products can bring on acne. A simple and effective way to avoid acne due to hair products is to pull your hair back off of your face. Pull your bangs back so hair care products do not come into contact with your skin, especially during the hot summer months. Acne in women can also be brought on by hormonal changes such as those associated with pregnancy. This means that the acne will go away after childbirth. Some medications can bring on acne. Some birth control pills can bring on acne. If you notice an acne flare-up after starting any new medication, talk to your doctor. There are many different types of acne treatments on the market. A spot treatment with a topical product, such as a benzoyl peroxide or glycolic acid, may be in order for you and may be effective. If your acne is widespread, a visit to the dermatologist might be in order. He will have more suggestions and may start you on an oral antibiotic. There are moisturizers and cleansers out now that take into account the needs of maturing skin along with being effective against acne. Remember, the overuse of any drying agent on the skin can actually cause the production of more oil, and more acne, a catch-22. Make sure that you follow the skin care regimen suggested by the manufacturer of any product you use. Regular facials can help to reduce acne flare-ups. The esthetician will evaluate your individual skin care needs and come up with a program suited to them. It may take 2 to 3 weeks of following any over-the-counter regimen before you see a difference in acne.